Imagine a world where drug users are treated with compassion. A world where health, safety, and dignity are prioritized. This is the essence of harm reduction, a public health and human rights approach. It recognizes that not everyone can or wants to stop using all substances. Instead of aiming for complete abstinence, harm reduction focuses on minimizing the negative impacts of drug use. Harm reduction serves to protect individuals and communities. This includes respecting the dignity and autonomy of people who use drugs. It promotes non-judgmental service provision and encourages realistic solutions backed by evidence. The ultimate goal: to reduce morbidity and mortality associated with substance use. In Zambia, harm reduction addresses multiple health crises like HIV and hepatitis. These are critical issues especially for marginalized groups like people who inject drugs, sex workers, and vulnerable youth. Let's explore 3 critical harm reduction services: syringe services programs, supervised consumption sites, and safer supply initiatives. Syringe services programs, SSPs, are vital. They provide sterile injecting equipment and safe disposal methods. In addition, SSPs educate users about safer injecting practices. The primary aim is to decrease the transmission of HIV and hepatitis through shared needles. Although Zambia has started integrating harm reduction in HIV programs, SSPs are still limited. Implementing SSPs can face obstacles. Legal constraints and stigma create barriers for users seeking help. In places where small-scale initiatives exist, they tend to be run by NGOs and community groups. Developing SSPs further requires careful attention to equipment supply chains, staff training, and community engagement. Now, let's move to supervised consumption sites, SCSs. These are places where trained professionals oversee the use of pre-obtained substances. Evidence shows SCSs can significantly reduce overdose deaths. They also help link users to primary care and addiction treatment. Currently, Zambia lacks these sites, but introducing SCSs could greatly improve public health. Launching SCSs in Zambia demands thorough community engagement. Clear service pathways need to connect users with essential healthcare. This includes mental health support and addiction treatment. Assessing spatial needs and staffing requires careful planning. Lastly, we have safer supply initiatives. This involves prescribing regulated pharmaceutical alternatives to illicit substances. It reduces the risk of overdose and exposure to dangerous additives. Safer supply models can range from opioid agonist therapy to providing regulated substances to high-risk individuals. The challenge in Zambia lies in the limited availability of these therapies. Developing a safer supply framework requires stakeholder consultations and pilot evaluations. Observing global trends can inform efforts, but local realities must shape implementation strategies. Integration is crucial. Harm reduction services work best when linked with HIV prevention, mental health care, and rehabilitation pathways. Peer involvement enhances accessibility and acceptability of services. Effective data collection systems help track outcomes and refine programs. In summary, harm reduction is an essential public health approach. It aims to protect and support those affected by substance use, particularly in Zambia. By implementing and expanding SSPs, SCSs, and safer supply initiatives, we can save lives and foster healthier communities. If you found this information valuable, please like and share this video. Consider subscribing for more insights on public health topics. Together, we can build a better understanding and advocate for effective harm reduction strategies.